Hello, dear friends, my name is Budowski Alexander, and today I would like to share with you one very important method that could help you to categorize patients into risk groups. The point is, this is a very good technique that could be a good directive for you how not accidentally get into troubles. The fact is that patients come to us with very different questions and very different complaints, and we do not see these hidden pitfalls which then lead to a lot of complaints and not only about dentistry. So, why do we often make mistakes? The fact is that we think that all the patients are the same, that they come to us for a tooth filling, but this unfortunately isn't so. All the patients are very different, and in order to identify them at the appointment, especially if you have a large flow of patients, we need to use a very simple rule that will protect you from so many problems. The first one, this is a triad of symptoms that you still need to find out from the patients. Even if you just fill the teeth and do nothing else. The fact is that even a small intervention in the occlusion of patients with TMD can lead to a lot of complaints related to completely different organs. So, the triad allows you to distribute patients into three groups. I presented them as a traffic light, and it very clearly shows where we can move and where couldn't. The first group, one of the biggest, is healthy patients, but I would like to call them conditionally healthy patients because, as you know, they are not completely healthy but incompletely examined ones. Nevertheless, there are lots of them. The second group, I'm not mistaken, this is the second group. It includes problematic patients who have problems with the joint. They have some complaint, they bring you such a pack of documents and examinations. They will say that they were treated incorrectly or their jaw relation was found wrong, or something like that. You understand that this group of patients is quite dangerous. In this case, the treatment must not be started with what? It mustn't be started with teeth. The treatment of this patient needed to be started with the problems with which they have come, or refer them to a related specialist. But the third group of patients is the most dangerous for us. It's compensated patients. They come to you and have no complaints. They say, I want to change the tooth filling, I want to change the crown, put me in an implant. They have very clear, specific requirements. They are ready to pay for your work, nothing at all. But suddenly you begin to treat them and you or another doctor, God forbid, get a number of complications, lots of problems. What does the patient say? I came to you what? Healthy. Now, what am I? Sometimes they say dental invalid. In order not to fall into this situation, colleagues, I call on you to use this triad. I call it, once again, the traffic light. So, to distribute patients into risk groups, you need to ask only three questions and find out only three symptoms. The symptoms, the presence of pain or soreness. If the patient has it, he will tell you, show you, and so on. There is a whole complex of special methods for determining pain screening, and we'll definitely talk much more about this. There are special techniques for calculating the occlusal index. It allows us to evaluate patients' adaptive abilities. But that's not the point right now. So the patient has pain, the first symptom. This is very important, but you need to ask about it. Not always patients tell you about it. The second is a disordered movement of the lower jaw. You just need to ask the patient to open his mouth. The opening could be restricted. You see, I'm talking now, but I'm not opening my mouth too much. You cannot understand, have I a restriction of the jaw's opening or not? Ask me to open my mouth wide. I open, and then what can we see? Is there a deviation of the movement of the lower jaw? It can be deflection when the jaw doesn't return to its initial place, and deviation when the jaw moves and returns to its initial place. All this is a violation of the displacement of the lower jaw. You will have a second symptom. The third symptom is what? Just listen. Does the patient have a click, a crunch? Often they always tell us about it themselves, but we do not always pay attention to it. They say, doctor, I eat borscht and I have a very strong click in the jaw and cure me. Colleagues, stop. If this one symptom from the triad, then treatment is not indicated. If there are two or more symptoms, so what? So we must begin a deeper diagnostics, and then we can determine if the patient has problems. What are they, and to begin treatment, first of all, with what the patient needs this treatment. And then, when the complication occurs, you have no need to make excuses and to say, yes, look, here, you have problems in the joint. This may be in the process of our treatment, as the patient needs to keep his mouth open for a long time, and you will ask to open his mouth wide. This may confront the patient with decompensation. But what are you doing? You show it before your interventions. You say that it can develop. You are warning the patient. If you started the treatment and the process has already begun, some pain has appeared. You begin to make excuses. Even if you understand that the process is old, many years, the patient will still associate, unfortunately, the development of these problems with what? With your intervention. Therefore, dear colleagues, I very convincingly ask you for individual approach for patient, and at least at the appointment use this simple triad of symptoms. Even if you are not a dentist, periodically neurologists handle this issue. You can simply ask your patient at the appointment to open his mouth, see if there is a bias or not, is there any pain, so then connect the dentist to your work. So, colleagues, more deeply and with details, we'll analyze this topic better in the process of our work, the process of creating our videos. Thus, subscribe, we'll be glad to ask your questions if something bothers you or you have some comments, we'll be glad. Like it, and see you soon. Thanks.